We are ready for 30.
Okay, we are ready. Good afternoon, everyone.
Hi.
Good afternoon, welcome, Mayor. Make sure you sign in, please. To the Seneca County Health District Advisory Council meeting. This meeting is being recorded and will be posted on the Health Department's website and on the County Commissioner's website shortly after the meeting. Thank you everyone for coming. So we'll call the meeting to order, which we all like to do as elected officials. We'll start with the pledge of allegiance. Pledge behind you, please. Pledge allegiance to the flag.
Stands one nation under God, indivisible, with liberty and justice for all.
Thank you. So our secretary of the DAC is Bill Biller, he represents Pleasant Township. I ask everyone to turn their phones off, please. Make sure they're on silent. And we want to do, let you go around the room. Let's take roll call. Yep, I'm gonna have you do it if that's okay. And I'm pretty limited right down here. Yeah, what's the sign-in sheet?
I have it right here.
Do you mind pass it down, Lisa?
Kind of easier. Foster and Mayor looking that time.
So Mr. Biller will read the names and I'm gonna compare them to the sign-in sheet, if that's okay. And you can help me out, sit right here. We're gonna have Mayor Kepler sign in. Yep. Coming down. That'd be great. Nice turnout. We appreciate it, everyone. I think we have to get it. Thank you. Yeah, I think that's the most. Yeah, it's okay. I want to get the sign-in sheet. We want to share that. I think we need call it off. Okay. Thank you, Mayor. Okay. I'll take a couple sheets. And as we call your names, I know there's one township that has more than one person here, so please identify yourself then, and we'll be good. You're welcome to sit at the table as an elected official, but you cannot vote, okay? Go ahead.
Thank you, County Commissioner,
Here.
Deputy Mayor,
Here.
Foster Mayor, Adams Township,
Here.
Big Springs Township,
Here.
Bloom Township,
Here.
Clinton Township,
Here.
Eden Township, Hopewell Township,
Here.
Jackson Township,
Here.
Liberty Township,
Here.
Loudon Township,
Here.
Pleasant Township, here, Reed Township, Scipio Township, Seneca Township, here, Thompson Township, Venice Township, Attica Village, Bettsville Village,
Here.
Bloomville Village, Green Springs Village, New Riggle Village, Republic Village.
Okay, and then the two mayors, we have to do the mayor of Tiffin.
Oh, yeah.
Yep. We got it. Okay. Let's do an official count. Drum roll. We're close. Real close. 13. Oh, we have 13. We need 13 for a quorum. So, boss, this is great. Here's the sign-in sheets. Very good. Yeah. Okay. Yeah, but we got overridden by the, Ohio Revised Code. So this is something new, which I didn't know before the meeting, and I had a chance to talk to anybody, including Ann. We have 14, okay, so, our bylaws state that the two city mayors are not part of the DAC. And the logic behind that is that the mayor of Tiffin appoints 2 members. The mayor of Fostoria appoints 2 people, and then the DAC, which is all of us in here, we appoint 5 people. And we've operated like that for years. That said, they're only excluded if each city has a separate health district. So in Seneca County, we have 1 health district. So the city of Tiffin, the city of Fostoria is part of the health district, therefore they now can vote on the DAC. So Ann and others are right, our bylaws state they can. Practice in the past was they didn't. But we're gonna make that correction, and I guess we all learned something from that. I bet you none of you in here knew that, right? Okay, so appreciate the 2 mayors coming, and they have a seat at the table. Okay, so we now have a quorum. I'll entertain a motion to approve the minutes of last year's meeting in 2022. They were emailed out. So moved. Okay, the first and second, I think you can.
Who was the first? I didn't.
The first percent, no, what's happening.
Okay, so Lisa, will you be calling roll?
Yeah, I can. Which township was the first?
Tim Lynch, Liberty.
Liberty. All right.
Yeah, we.
Yeah, right,
All right.
Thank you. Perfect.
Okay, so you want to go ahead and call roll then? Go ahead and call roll.
Please.
Adams Township?
Yeah.
Big Springs Township?
Here.
Loon Township?
Here.
Clinton Township? Hopewell Township?
Yes.
Jackson Township?
Here.
Liberty Township?
Yes.
Loudon Township?
Yes.
Pleasant Township?
Yes.
Seneca Township?
Here.
The Village of Betsville?
Yes.
City of Fostoria?
Yes.
City of Tiffin?
Yes.
And County Commissioner?
Yes. Okay, minutes approved. Moving on, it's time to, I was gonna move this to a later part of the agenda, but I'll leave it where it is. Right now, it has to reorganize for next year. Officers are in place for this meeting, so we will need a nomination from the floor for president and secretary for next year.
Nomination for commissioner meeting.
Okay, we have 1 nomination, the commissioner be president. The way our bylaws read, so public and everybody's clear, there's only 1 representative from the commissioner's office appointed to the DAC, and that is the board president. That said, the county commissioners reorganized first week of January, and we assigned committees. So if the 3 commissioners were to decide that whoever next year's president is would not be on here, we have that ability to appoint somebody, one of the 3 commissioners. So we have a nomination that a commissioner be president. Anybody else want to nominate? I guess we'll stay with the commissioner. We'll know the president's got it. Do we need a second on that? Yeah, if we don't hear anything from the floor, yeah, we need a second. And we'll have it. Okay, we have a second. Any discussion? Okay. Hold that thought. We're gonna add secretary to it, so we don't have to go by. Anyone going to nominate Bill as secretary for next year?
I'll second.
Any
Jackson, Rickman, Jackson.
Okay.
We have a first and a second, any discussion? Okay, roll call.
Adams Township,
Yes.
Big Springs Township,
Here.
Bloom Township,
Yes.
Clinton Township,
Yes.
Hopewell Township,
Yes.
Jackson Township,
Yes.
Liberty Township,
Yes.
Loudon Township,
Yeah.
Pleasant Township,
Yes.
Seneca Township.
Yes.
Village of Betsville,
Yes.
and City of Fostoria,
Yes.
City of Tiffin. Yes. And County Commissioner.
Yes. Okay, thank you. So, next on the agenda would be, our nomination for, Board of Health vacancies. I'd just like to make, thanks for, reminding me of that. So everyone has their agenda. We're on F1. We want to talk about, who does not have a copy of the geographic representation sheet that was handed out? Does anyone not have a copy? Okay, so I'd like to make a couple comments on this. Bird. I'm going to defer to my colleague here. We have Eden Township that just walked in. Can they join the meeting? We have a, can they join the meeting at this point, Mayor? Everybody agree?
Yes.
Okay, so, Vernon, Waters here from Eden Township. Would you like to come sign in and join us? Thanks for coming. Sign in sheet. And we have, okay. Where can you squeeze in there? Yeah, or there you go, yeah. Thank you. Vernon Water Township trustee, Eden Township. Okay, so Ian and I had discussed this last year, right, at the last year's meeting. And the Board of Health actually had a letter that they kind of supported the idea, and the gist of this proposal is to try to, I don't like this word, but mandate that there is geographic representation on this board. Okay, I wanted to bring it up for discussion. I've had a lot of people come to me that gave me their opinion, and so I'd like to go around the room and talk about this before we even vote on it. We may or may not vote on this, but I think this is good stuff. It's something we should all talk about, and I want to get it open the floor up to discussion. They want to start out. You see on the second page, there would be Group A, B, C, D, D. Currently, if I look at the board roster, we have a representative, Mr. Watson from Reed Township on the board. And we have a person over in Eden, but Pleasant, we east or west, then we define it. We're in the middle, right? I think we're in the middle. So anybody want to have any comments?
Could you explain that just a little better? Okay, there's nothing in right now.
Yeah, that's what it is. So I'll explain, then I'll let Ian speak, and then we'll have a final discussion, and we'll wrap this thing up, okay? So there's a group of people that feel that the best candidate, no matter where they're from, can put their name in, and we can listen to them and vote and put them on the DAC. Okay? We are, is that fair? The Board of Health. The DAC can put them on the Board of Health. Thank you. Ian and I talked about
should we make this a policy? Should we put it in the bylaws? Do we even need to take action on it? Okay, and then I agreed with Ann that I would roll this out on the table for all of us to talk about. I haven't received some calls, but I'm just curious to see if, am I blindsiding everybody? Are you not kind of aware of this? Maybe it was buried in the email notice and we didn't really talk to you. Is that fair? I can see that, but yeah, I can tell the look on these things. Okay. So, I think this is what I'd like to do. I'd like to table this. I don't want to vote on this. Okay, and I'm going to give Ann credit for doing a lot of work. Because I've had a lot of people come to me and they didn't think this was necessary. But I want to put this on the agenda for next year. Okay, is that fair? We can all talk about it, think about it. I don't want to slide this in because I don't like another layer of government regulation personally, but I'm one person.
Tony, can I?
Yeah.
Many moons ago, I could, we at Liberty Township, we always gave them a name beyond Royale. And at that time, I thought that was kind of the way it was, but we didn't, they didn't have a group, but they did ask us for a name, and I think Carol Lynch was at one time, and Beth Lockout, and then after that, nobody seemed to ask us if they wanted to for us to submit a name. So I don't think this is a new thing, but it hasn't been done for quite a while.
Okay, Roger.
What's the current makeup of the board? I mean, is it geographically spread or is there a problem? More than one comes in?
I'll let you.
Right, yeah, so currently there are 2 from group A, 1 from group B, and 1 from group E, and a temporary appointment from group C, if I remember correctly. And the question actually came originally from the Board of Health itself, wanting to know how does the DAC ensure that it meets this section of code that says that geographic representation or balance is maintained. So the question originally came from the board itself, and that's why I took it to Tony and said, Tony, this is a concern. How can this be accomplished or ensured that you have the entire county's residents have the opportunity to have a representative on board?
And is it required by the code that we do that?
Not necessarily in this manner, but what the revised code actually says, I don't have it right in front of me. Let me see. Right. It doesn't say geographic balance, but it's with all, okay, yeah, so with due regard to equal representation of all parts of the district, that's the wording from the revised code.
So what's happened in the past, there's a couple things that I think are positive in preparation for this meeting. We have two representatives from the villages there. Derek cited in the revised code that townships, villages, cities, if the 2 mayors couldn't come today, they could designate representation to the meeting. So I don't think that's been done before. Like at least everybody I talked to, you're an old timer, Vern and Tim, nobody's been around longer than you. You didn't. Did you always have that? Okay.
Yeah,
So-
I don't know what the procedure was today.
Yeah.
You say they have to have an actual resolution.
You have to actually have a resolution. So the mayor can't just write a letter to the township trustee saying, you know, the road guy's gonna be there for me. You have to meet and then formalize it. Okay, so I think what's nice is we have, people at the table and we can have this discussion. You know, in the past 3 years I've been here, we haven't had a forum and it's just been really awkward. Or you're not talking about as well, so, yeah, I mean, I guess. If our intent is to do that, we need to do a better job of communicating. One of the ideas that came up was that we would get together at the township meeting, whether it's in December or whatever, and talk about this, so we can begin preparing. Villages is a little more of a challenge because you don't get together as a group, right? Six of it, but,
Can I ask a question, please?
sure.
How is this being communicated? When I found out about this meeting, I asked Donnie, and sorry, Mayor Homer, he knew nothing of this meeting. So my concern is there's breakdown in communication from the beginning.
So, the notification, goes out Board of Health, okay? Looking at the list, brought to all our attention that some of the emails were not.
So are not being verified before you send the email?
Well, I think we did the best it could with the roster we had, so we sent another one out, plus you mailed.
Plus we mailed it.
Plus we mailed it.
Okay, I
Right, to the
will
village
address
office.
that tonight at the meeting.
So, you know, it's never perfect, but that's what happened. We had three. Two for sure should have got there. Now, what happens is, we don't send the mail to all six members of council, and the mayor, most of the time, goes to the fiscal officer, right, that's practice. And then they would present it, so, when did we send the notice out?
Well,
So
that's not
one
enough
thing-
time for a visit.
I agree. So
That should
the
have
one
been a
thing
long
I
time
think we
ago.
could do better, so I,
We only need.
will take responsibility for that, is that you need more lead time for villages. Council, right, Mayor? I mean, they post, they meet, and so this is odd, but when we leave this, if you look at the minutes that we all just approved, this year's meeting was on last year's minutes. So before we leave, we set the meeting for next year. Now, nothing's perfect. So let's all agree with that, right? We have new people, we got new people in the audience, we have new electeds. So this used to be a one-time, it's obvious that we need to do a lot, we need to do multiple things of communication in advance to help build a forum and to help get people involved so that, you know.
Time of day is also a concern. Most people work. When you're talking village and township, a 3:30 meeting hard, people are working.
Well,
Maybe
we've
move it
tried,
to the evening.
we've tried lunches, haven't we, you guys?
This is moved around a lot.
We tried 3:30, we tried 7, it's hard. I
It's
agree.
even been tried in the morning.
In the morning, so I just so everybody knows, this is not, we've really, and I've only been, it's my fourth meeting. Okay, so I know prior to that, there has been a lot of effort, but clearly we can improve on it. And by you coming and speaking, is a good thing, thank you. Does anybody else want to add anything to Ann's comments? How do you feel about making this formally a policy or anything other than that?
I think I agree with you. I think let's table it and take a look at how the divisions are and how they, you know, geographically represent everybody, and then next year maybe make it a.
Okay,
I agree with that. I agree with that.
If is there any requirement for there won't have to be a doctor in it?
Correct.
So which might play into some of the thing, you know,
Yeah,
you
it
might be able to get some.
doesn't have to be one of the DAC appointees though.
Oh,
It can be any one of the nine. So it could be a mayor or the mayor's appointees or the DAC's appointees.
I don't know if you want to lock it down quite that much, I guess.
One has to be a doctor on the board.
Yes, on the board.
How many's on the board?
9.
so Kevin, 5 comes from the DAC. And I just want to remind, this is for the public, and then we're going to move on, if that's okay. Just to remind the public, there are 24 members of the DAC, 24. 1 commissioner, so the commissioners, this isn't our thing, okay? 8 mayors. One from the village and the 2 cities, and then 15 township trustees. So we're all in here, we all have one vote on whoever this person is that gets appointed. So this meeting, there's a little bit of this housekeeping and this business part of the meeting, but the real purpose of the meeting is for the health commissioner to report to the entire county, including Tiffin and Fostoria, the state of the health department. Right, your finances, she's got staff here to talk. So, you know, it's all 24 entities make up the county. So this is not just township and villages or commission. So I really appreciate having, we had 14 before, plus we have 15 here. I think we have 15 out of 24 here, and we would have 2 more if we got the notices out. So we apologize for that, but we learned a little bit, and next year, I promise you, we'll, with everybody's help, we'll get good communication. Okay?
Well, I think, the Ohio Revised Code states that the trustees are supposed to have one representative on this board. Now, I know in the past, sometimes they're not didn't always happen, but, you know, we have 15 townships. And
Well, they're on the board, they just don't come. They just don't. Yeah, they're members, but they wouldn't come. Right, Kevin? Go ahead.
Who appoints the other 4 members?
2 by the city of Tiffin and 2 by the city of Fostoria.
So do they have a vote on the board and
They do, yeah. They have to have a vote on this board.
Even though they appoint?
And so Kevin's question is, and I think we just should get this out here for the public, so there's any confusion, okay? We have the mayor of Tiffin sitting here and the mayor of Fostoria. Each of them can appoint 2 members to the health board, okay? And Kevin's question is, and they still have a seat and they can vote here. Our bylaws say, to Ann's point, that they can't vote. We have bylaws, but the Ohio Revised Code says they can vote. So in talking to Derek, that supersedes our bylaws. It's his recommendation that we allow them to come and vote. Here they are, they were invited so they can vote, and we're gonna have to amend our bylaws to reflect that. Did I say that? Okay, everybody agree? Okay. Okay, so we're gonna move on with the agenda. Good conversation. And we don't have a first or second. No, we're gonna table some questions, we anything table this. I'd like to let the minutes know our conversation, no vote, no actions taken, and we will discuss next year. Okay, that'll allow a lot of discussion and hopefully enthusiasm to get some other people on board. Okay, and I think we also have to remember that these seats are for 5 years and there's 9 seats, so it's not like we're coming in here with a whole bunch of people to pick up here, because there is. But every person that we vote on is important, and we're all here to make that recommendation. Okay, we good? Okay, we have 2 seats that are up, one expiring term of March 25, and then a new 5-year term that expires in March of 28. We have 3 individuals that have put their name in the hat. I have personally phoned all 3 of them and invited them to speak for up to 3 minutes before we get into the vote. So we'll start with Dr. West, if you'd like to come up and tell us why you're interested in this position and so forth.
All right, well, Commissioner Paradiso, members of the DAC, I'm Dr. Zachary West. I'm a 3rd generation resident of Seneca County from Pleasant Township. Went to Old Ford School, graduated from there, and then went on. I have a master's in public health and a doctorate in osteopathic medicine. I bring a different, unique background to the board, both being a doctor of osteopathic medicine in internal medicine, which is adult primary care, and osteopathic neuromusculoskeletal medicine. along with the public health background that I had. I was asked to join the Board of Health. There was a vacancy at the time, last September. I interviewed, was made aware of that vacancy. I was at a place in my life where I was able to come join the board and bring those skill sets and knowledge and background that I had, and bring it back to the community, to my hometown and to my home community. Interviewed and was seated in October and have served since October in that position. Being able to bring that skill set, like I said, that knowledge to the board and that perspective. There's a lot of matters before the Board of Health. I've been working and hitting the ground running hard. And so I appreciate the consideration to continue to serve on that Board of Health and continue to bring those skills into my community and for the remainder of that term. So,
Thank you. Who's next? Who's coming next? Watson?
I'm Robert Watson. I'm from Republic, Ohio, Woodbury Township. My family was here from the beginning of Seneca County. I'm a retired accountant. I'm retired from Tiffin University. I was the controller and assistant vice president from Tiffin University. And I was originally appointed to by the DAC to complete a term, and then I have fulfilled one full term. My expertise is in finance. They wanted somebody that had accounting experience, and I fit the bill. And that's how I got here. Recently, I've been involved with, by the way, I'm the chair of the finance committee. I forgot to mention that. Recently, I got involved with placing H2S and SO2 metering stations, and I've been working with the environmental committee, which I'm not a part of that committee, but I did it anyway because I felt it was important to the people on the west side of Seneca County. It's my intent to see this project through, and that's why I continued to run and ask to be considered. Also, the health and the environment of Seneca County residents has always been a great concern for me. And that is basically why I chose to run again. If you got any questions, throw one at me and I'll try to answer, but that's who I am and that's what I represent.
Thank you. Then we have Ellen Whiting. Anything else?
Hello, good afternoon, everyone. Thanks for your time today. I'm Alan Wynandy. I was born and raised in Seneca County, a graduate of Newrigal High School. My wife and I, we just moved back to the area. We had to move for my employment for the last 3 years. I work in the electrical utility industry, so power lines, substations, been doing that for 23 years. With that, I get a good taste of environmental and safety rules and regulations and keeping contractors in alignment with those. So pretty good understanding of those policies and regulations. Served on the Bettsville Fire Department for 9 years prior to us leaving and got to the rank of captain. So good experience with hazmat training and everything the fire department does. Before I left and won the fire department, we bought a new engine. So, being a captain, I was involved with the finances of the fire department and working with those tax dollars, trying to spend them responsibly. So, that's an important part of the health department and what they're doing is spending those tax dollars responsibly. So just looking forward to serving in Seneca County again and leaving this place as good as I can for my children and their children. So thank you. Appreciate you guys' support.
Thank you. So we have, gonna lay out the situation to everybody. On 2/23, that's February 23, and sent me an email that you received notification that Dr. West and Mr. Watson wanted to run. Okay, so we had two names that they said they want to run. On March 7th, the county commissioners received a letter. I think you were copied, right, an email.
Moretown. Okay, that, Mr. Andy wanted to run, and he wanted to run for Mr. Watson's seat. They didn't quite understand that, went over and talked to Derek, the prosecutor. He said, yes, it's no different than if you were running for a township trustee seat or council or commissioner, you pick somebody and you run against it. So, Mr. Wolf's seat, for the record, is, he was appointed, and when you're appointed midterm, within that 5 years, you fill that time up to the meeting, and then if you are approved, you complete the term that you're in. So if I'm reading this right, Dr. West his term would go to 2025. Okay, so we would be voting on Dr. West to complete the term that he was appointed to. So with that, I'd like to do Dr. West, or vote on Dr. West first. Please.
We would need them.
We need a motion. Do I have a motion to,
Could you clear that up a little now? Dr. Wolf or Dr. West? West? Oh,
yeah,
okay.
thank you. Sorry,
He is filling out the term.
I got it.
To make it official.
Yeah.
the rest of the term.
and I'm sorry for jumping ahead. We need a person, a motion.
I'll move to, Dr. West to, for the unexpired term until March of 2025.
I'll second it.
For any discussion? Sorry, any discussion? One more.
No, we can't not, the other two people aren't in on this.
They're on the next, they're gonna run the next,
All right.
okay?
Yeah.
Odd, but, it's, yeah, that's what's happening.
And still the unexpired term.
Yeah, we'll build the unexpired term first,
All right.
okay? Any other discussion? We good? Over.
Adams?
Yes.
Big Spring?
Yes.
Bloom Township?
Yes.
Clinton Township?
Yes.
Eden?
Yes.
Hopewell?
Yes.
Jackson?
Yes.
Liberty?
Yes.
Loudon?
Yes.
Pleasant?
Yes.
Seneca?
Yes.
City of Betsville?
Yes.
City of Fostoria?
Yes.
City of Tiffin?
Yes.
County Commissioner?
Okay, motion passes. Congratulations, Dr. Webb, for 2 more years. Okay, next, next we have a 5-year term ending March of 2028. And I will entertain a motion to move forward with the vote. Again, we have Bob Watson, Robert Watson, and Alan Langen. We will be voting on one of those two.
I move that. Go ahead with it.
Okay, good.
Okay. We're voting on one of those two, or is it, or,
Is that how we do it? Yeah, I was gonna just read their last name and go around, but
okay,
we're in discussion mode. Would you say we vote for one and then vote for the other one?
I think it's about, probably find it easier to say, are you voting for this person or that person?
And then when we do the
That
vote,
once.
yeah.
okay.
Okay, so we will leave that up to Lisa. Are we clear on that? So, are you good with that?
Yeah, who was the first and second?
So it's gonna be Watson or Andy, right? Is that how we're gonna reply to you?
And then our,
And it's,
who was the first? What township were you? At what township were you from?
Jackson.
Jackson. And then who was the second? I'm sorry.
Similar.
Okay.
Any discussion? Are we good?
so we're gonna say,
Let's say the last name, yep, Watson or Andy. And, we'll let Lisa, is that good? Okay, we'll make sure we're on.
We're good.
It's always nice for everybody to know I'm here to correct me, so I can take it too.
Roll call.
Adams, Dick Spring,
Boy, Andy.
Bloom,
One Andy.
Clinton, Eden,
Boy, Andy.
Hopewell,
Why, Andy?
Jackson,
Why, Andy?
Liberty,
Boy, Andy.
Loudon,
Fine, Andy.
Pleasant,
Boy, Andy.
Seneca,
Boy, Andy.
Bettsville,
Fine, Andy.
City of Fostoria,
Boy, Andy.
City of Tiffin, Watson, County Commissioner.
Watson. Hold it up for us.
I have 12 for Andy and 3 for Watson.
Okay, so, my Andy, welcome. Okay, board and, Good service and, we move on, thank you. Good job, so I believe, does that conclude my business, yeah? Okay. So at this time, thank you everyone, we're gonna turn the meeting over to Ann, the second county health commissioner for her update.
So you have a copy of the annual report in your packet. And I'll basically do a quick review of what we've got here. So in our services overall, we're guided by providing a 10 essential public health services. And so that's what we need to make sure that we're providing that full array of services. And so that's the undergirding behind what you are going to see in the annual report. The other piece is what we call foundational public health services. So there are certain services that all health departments should do everywhere. The public health system or anywhere in the state of Ohio or across the nation. And so many of the items that we'll report on in this annual report relate to those. They're foundational in nature, things that you should have in place for every health department. So in my message, I focused on what are some of our accomplishments in 2022. Really, we were looking at what were the gaps that we identified during the COVID pandemic response, and how could we fill those gaps? And as much as that, we use COVID dollars to help us do that. So we created a position that focused solely on health communications, because communications was one of the gaps that was identified during the pandemic. We had a position that did that as one of many pieces of their job. And now we have a part-time position that's solely focused on health communications. Related to that, we improved our website. We updated the entire website, and are now using social media on a much more frequent basis to communicate information. So there are daily Facebook posts, for example, that are done, as well as a press release each month and various other ways that we get information out now. One of the positions that we had previously shared with a neighboring health department was our emergency planner position. And when we were just trying to meet grant requirements, that worked okay. However, in the middle of the pandemic, it did not work well at all, because that person got pulled to their home agency, home county, and we received very little services. And so that was one of the gaps that we identified that we needed to do was to move away from that contract position and return it to an internal position. And so that's the emergency planning position that we're using COVID dollars initially to fund, and then we'll be using other sources of funding in the future. One of the other areas that we identified during the accreditation process was the need to have someone who really does health planning, who looks at the data that's out there about our county residents, that works with other entities to implement the community health improvement plan, and to make sure that we stay on target with accreditation requirements. And so that was another position that we had created. We had someone who was doing accreditation very part-time. And so using some resource dollars that we received through the CDC for specifically public health infrastructure of building our capacity, our workforce, we're using those funds to support the health planning and accreditation position. We got new software, or we didn't get new software. We're using new software for vital statistics, which makes it easier for people to get their records when they want them at a lower convenience cost, a lower service cost. And so when a person goes to our website now, they can literally go to the tab that says, you know, order online, and there's a process for them being able to order their death or birth certificate online. We did use COVID dollars as well to replace our outdated computers and software. We were actually operating still on Microsoft Office 2010. And the computers that moved very, very slowly. And so that was one of the investments we made with COVID dollars, was to update our hardware and our software. And then we joined a local public health services collaborative, a group of about 35 different health departments across the state, where we all go together to do billing as one practice, basically. So we have access now to an electronic health record that has integrated billing software. So we're able to collect we're able to credential our staff. We're able to, they negotiate the contracts for us with the insurance companies, and through them, we submit the billing and get that reimbursement back. So it's much more cost effective and efficient way of doing it. So those are some of the highlights of what we accomplished this past year. The other thing that I mentioned in the message is just noting that one of the surveys that we did as part of the whole public health system was looking at the impact of COVID-19 on health department staff across the nation. That was called PHWIN, Public Health Workforce Interests and Needs Survey. And one of the things that revealed was that 1 in 4 staff at the Seneca County General Health District reported 3 or more symptoms of PTSD as a result of COVID-19 pandemic. Much of that was due to the expanded workload, the way that they were treated, whether that was on the phone or in person, and just the increased stress of, not only was it stressful for everybody in the county, but they had the added stress of trying to respond in addition to having to deal with it themselves in their own homes. The mental health and the workforce needs is one of our priorities in this coming year. On page 2, you can see who was on the Board of Health last year. And obviously that changes every year. So serving the latter half of last year, Ed Logston, representing the city of Astoria, was the president. Scott Lyons, appointed by the DAC, was vice president. Mark Akers was a position member initially, and he was appointed by the city of Tiffin. Bonnie Boroff by the city of Tiffin. Mackenzie Posey was a DAC appointee. Natasha Vitt is a city of Astoria appointee. Bob Watson was the district advisory council appointee. Zach West was the temporary appointee by the Board of Health until this meeting for the DAC, and then Clay Wolf was appointed last year by the DAC. So looking this year going forward, our president currently is Clay Wolf. Our vice president is Zach West. Mr. Watson, this will be his last meeting this month. And Mr. Wanyandy will come on. And then we've also had a resignation just in the past week. We're off resigned from her position. So that's a position that has nothing to do with all of you as far as making the appointment. So our team of staff, you can see there who's on our staff. That's a required piece of our annual report. We report on who our staff are. So you can see there who was on our staff as of the end of last year. They're organized into several different sections. So environmental health, that's pretty obvious. Those are all registered environmental health specialists or specialists in training. Health planning and promotion. We have several staff there. We go vacancy right there right now. We're trying 2 vacancies actually in that area that we're filling. And And then public health nursing, obviously mostly our nurses. And then we have our mainly dietitians and other health professionals that provide those services. And then you can see as well, physical and vital statistics which fall into the administrative sector. On page 4, you can see, this is not new information, but our vision and mission statements, as well as our core values, that staff and management work together on in 2020 and 2021. That's not new, that's certain information. One of the things that we do together with all of our partners across the county is a community health assessment every 3 years. And that was completed and released at the end of 2022. And so we have just a few of the highlights on page 5. So from it, we do both the adult survey and then youth are involved in a statewide survey, and then we get the information for the whole county as a whole. So that's where the data comes from. So the adults there, you can see that 39% are obese. When you add together overweight and obesity, 77% of our residents, or 3 out of every 4 adults are actually overweight and obese, which links then to whether our leading cause of death, which is heart disease. 38% had high blood pressure. 36% actually have high cholesterol, again, linking back to our primary leading cause of death being heart disease. 25% are binge drinkers, which is, there's a standard definition that's used for that, drinking 4 or 5 drinks within a certain short time period, but all in one sitting, basically. And then 15% were diagnosed with cancer at some point in their lives. If we look at the youth, the ones that stand out the most there, was that 77% of our youth only had 1 to 4 servings of fruits and vegetables in a 1-week period. And considering that we're supposed to have them every meal, that's a pretty low percentage, a pretty high percentage that don't get enough. If we look at those reporting they were bullied in the last year, 43% reported that. 24% are overweight. Obese. I do have a number here. Let me find it. Those combined. It's actually a total of 42% when you add overweight and obese. And then 19% seriously considered attempting suicide in the past year. So mental health is one of the things that came up very clearly in the community health assessment. That's not the only statistics that supports that, but that's certainly one of them. Some of the other ones that relate to that as well is that 1 in 3 local adults rated their mental health is not good or on 4 or more days in the past month. 13% of local adults felt sad or hopeless almost every day for 2 or more weeks. 44% of youth felt sad or hopeless almost every day for 2 or more weeks. And then 19% of local youth were electronically bullied in the past year. So that links to what we see as far as overdoses and suicide in the county. We have one of the higher age of death and suicide rates in the state. Not the highest, but certainly one of the higher. And then our overdose deaths were going down from 2017 to 2019, popped up in 2020, were lower in 2021, and we just completed the suicide and overdose fatality review, and that number, I can see a small thing, was about equal with what it was last year. Yeah. So what we do with this data is that whole group of community partners and organizations, which can be everybody that can be part of that process, develops a community health improvement plan. And that community health improvement plan, we set priorities in that as a group. And so there are some that are related to mental health and addiction. There are some that are related to chronic disease. There's one in there that relates to bullying. Housing, transportation, those are all focuses of the current community health improvement plan, but we'll be updating that with this information. So we're actually scheduling a community health improvement planning session for next month to create the updated what we call a CHIP. So If we look at pages 6 and 7, that emphasizes some of the things that we do within the health promotion and planning section. So you can see there the statistics that were provided by our health communications specialist. How many Facebook followers we had at the end of 2022, how many Facebook posts were done, how many Instagram and Twitter followers there are. So those are the 3 primary social media platforms that we use. Press releases, radio interviews, TV interviews are pretty uncommon, but radio interviews are pretty common. And so then you can see the 2 staff that manage these areas. Dr. Huffman and Dr. Schaefer. Dr. Schaefer is no longer with us. But so that's one of the positions we're working with. And then our naloxone program is one of the pieces within health promotion and planning, where we provide naloxone training, we distribute naloxone. We have some partners that we distribute it through, but we also do distribute directly to community members if they want to come in and get training and have it available at their home, at their work, at wherever. And then car seats, we do car seat program that's provided. Those are free of charge, so we do accept donations for parents that are income eligible. We have one of our staff who's a nationally certified child passenger safety technician, and she works in our WIC program. Then environmental health, you see are the pages 8 and 9. So a wide variety of programs that these staff are responsible for. From anything from bathing beach inspections to tattoo or body art establishments to food service operations. More commonly, what people think of are the different types of facilities that are inspected and licensed on a regular basis. The frequency is determined by statute of how frequently each type gets inspected. The state comes in then to survey us as well. So not only are we looking over the people that are licensed, they're then looking over our shoulder to make sure we're doing the program the way they want in time. On the opposite page, you can see there the animal bites and complaints that we get and investigate, operation and maintenance permits, or septic permits as well, private well permits, those all are under our area of responsibility. There's various different types of inspections done. So you can see that's where lot splits, real estate, and landfill inspections fall. Thinking along the lines of landfill, we're actually required to do 4 per year. So you can see we've already exceeded that requirement. And then the registrations that are complete. So there's different types of providers, environmental health providers that we're required to register. Those could be septic system installers, water haulers, different things like that. And then condemnations are an area too. So if a house is deemed to be unfit for human habitation, the Board of Health can condemn that house. And then if the homeowner improves it so that it does again have electricity and a working septic system and working water system, then the condemnation can be lifted. So last year there were 12 that were condemned and 6 that were rescinded. On public health nursing on pages 10 and 11. And our public health nursing do a wide variety of programs as well, ranging from community disease control, which is one of those areas that is a foundational responsibility of the health department, to providing immunizations, working with children and their family who have medical handicaps. As a state program that provides additional, so like a pair of last resort when someone has a condition like type 1 diabetes, cystic fibrosis, developmental disabilities that are caused by congenital malformations or something like that. Those are expensive conditions, health conditions, and insurance doesn't pay everything. So the state has this program called Children for Children with Medical Handicaps that helps cover some of those additional expenses, ones that aren't picked up by Medicaid or private insurance. So our nurses work regularly with their families. We do other types of services as well. Senior health clinics, we receive a small grant for that, so that we provide nursing clinics or seniors that want to receive that service. They make a lot of referrals. And then one thing that we had last year was a falls prevention grant that allowed us to have, grab bars installed for seniors that, needed them, so. So we try to identify small mini grants, out there as well as large grants to help support the services.
Do you write your own grants?
Yes, we do. Then on page 11, you can see a summary of what happened with COVID-19. Case-wise and hospitalizations and deaths. Most significant is that the month of December and January, were the months of the highest, actually, the entire pandemic. And so you can see that reflected in the graphs that are there. There were a total of 39 deaths that were recorded last year, many more the year before. And then, page 12 also has some information related to public health nursing as far as the total number of vaccinations given, which was just over 5,000. We do school nursing services, so vision and hearing screenings, are included there. Communicable diseases that besides COVID, so there's other ones that we investigate anyways. And so that's what's reported there, that 492. We provide nursing services under contracts with the youth center and Crossway. So our nurses are there, those facilities, every day or nearly every day. And then other types of vaccination clinics that we do. Page 13 summarizes for you the leading causes of death in our county last year. So heart disease is number 1, and that's true for the state and the nation as well. Cancers are number 2. That's the same for the state and the nation. And COVID is number 3, and that's also the same for the state and the nation. Where ours are slightly different are number 4 through 10. So you can see their kidney diseases are number 4 versus for the United States, unintentional injuries are number 4. We have COPD as number 5. And that's actually number 6 for the state. Strokes is number 6. That's number 5 for the state, nation. And then unintentional drug overdoses, it ramps up there, number 7 in our county. So that is significant, and one of the reasons that the community health improvement plan focuses or addresses addiction. Number 8 is pneumonia and flu. Number 9 is unintentional injury, so like vehicle accident. And then number 10 is suicide. So again, unintentional drug overdoses and suicide do not rank in the top 10 for the nation as a whole. You can see there how many birth certificates are births that we have in the county, 826. So yeah, it's more than we thought. We are the overall losing population from the 2010 census to the 2020 census. We had a 3% drop overall in the county's population. And as we know in the United States and around the world, the percentage of population that's age 65 and older continues to increase. It went from 16% in 2010 to 19% in 2020. And what that does is it creates an economic challenge, not just a health challenge, but an economic challenge, because you have fewer of working age that are having to support more that are not of working age and that have higher health needs. And so that's a challenge that many countries find.
Can I ask a question about the file statistic?
Yeah.
You got 826 persons below that, you got 2,200.
That's how many birth certificates, birth records have been issued. Right, so if somebody comes in and they need to get a driver's license, they need a birth certificate. Yes. Mhm.
What about the same thing down on the death?
On deaths, yes, that's the same thing. Yeah, often when somebody comes in, you know, they've had a death in their family, they need to get one for this insurance, one for that insurance, I mean, yeah, so there's more. Yeah. Which services are covered on page 14? And probably the biggest challenge the whole year was the formula shortage, which presented lots of challenges here in Ohio and elsewhere. But you can see there our average caseload, which is made up of women who are pregnant, women who are breastfeeding or are postpartum, infants and children up to the age of 5. There's an average of 933 that we serve every month through this program. Breastfeeding is one of the most cost-effective ways to provide nutrition to an infant. And so the challenge across the state as a whole is to try to optimize the breastfeeding rate. So 51% of our mothers initiated breastfeeding. And then you can see the value of the WIC benefits to our local grocery stores that serve as the vendors, so $606,000. And then you can see in the bottom chart is what's the value of the food packages that they receive. Farmers market is one of the areas where our WIC program helps support the community as well, because our WIC recipients can use their coupons at a farmer's market, which is ideal, getting more fresh fruits and vegetables.
Do we know that number?
Pardon me?
Do we know that number?
The amount, $2,195. And then the last two pages are our finances. So you can see there, our revenues for 2022 were 6.2 million. And you can see where those revenues come from. So both in a pie chart and in actual numbers. You can see that the largest portion come from environmental health fees. Nearly, I would say, it looks like 66%. About almost 60% of that is related to C&DB fees related to Sunny Farms landfill. And then the environmental health programs as well, all have fees associated with them. The tax levy, you can see is the lighter blue on the left side. That's about 422,000 last year. Subdivisions is the portion that comes from all of you. State subsidy is what we receive from the state. Since we're now accredited, and what we get has changed from 17 cents per capita to 34 cents per capita. That's in comparison to states around. The states around us typically put in $3 to $5 per capita. So Ohio, there's a reason our health value and our health outcomes are poor. It's because we don't put money into the types of services that prevent disease. You can see their clinical services, so like immunizations and other clinical services that our nurses provide. That's almost 300,000 in income. Vital statistics 110. Grants and contracts for $1 million, because that reflects a lot of COVID grants in 2022. And that's the thing that's unusual about this year. And probably our 20 and 21 results as well. They reflect a lot of COVID grants that are one-time funds. The thing to note is that nearly all of these revenue streams are restricted. So while we receive a lot of money from Sunny Farms, what we can spend it on is very, very limited. We can only spend it on things related to Sunny Farm, or if it's food service operations, it can only be spent on staff and expenses related to food service operations. So the overwhelming majority of our funds cannot be used on anything other than what they are. Yes, they're all restricted. Then our expenses, you can see on the last page, with 5.4 million last year. With salaries being the largest portion other than fees collected and paid. So salaries 1.3 million. And then you see the fringe benefits right next to that. The fees collected and paid reflect in part what comes from Sunny Farms that we pay them to the county commissioners, the Loudon Township trustees, the state EPA, and the state Department of Natural Resources. There are other fees that we collect, that we're required to collect, that we have to remit to the state. So for all of the food service lines, all the water wells, all the septic systems, there's a certain parts that we have to pass on and pay to the state. So over half the money, or roughly half the money that comes in our door goes right back out our door to those other departments. Rents and leases, like our building and copy machine, postage machine, things like that. Is what falls under rents and leases. Travel and training is pretty restricted as far as how much we did because of COVID. And then contracted services. Remind me, Anita, what's in that one? What's in contracted services? Yeah, I was my, I asked for too fast.
IT,
yeah.
sorry. Well, there's the, the copier, the maintenance agreement, postage, position is, any kind of the computer, the service that we have from the computer people, what else? Yeah, I don't know what else, thanks.
So, you can see there on the last page, we provide a really brief summary, that the audit committee reviews the, basically does quality assurance, with us. And to ensure that, we do everything, have good internal control procedures and all of that. We have clean audits. And we have this every year. So that's the summary of what we've done over the past year. And some of what we plan to be doing in the year ahead.
Any questions on the interim report?
Sure. Then the other packets, the other staples that you have that uncolored. The first page is the apportionment or the allocation. The funds that come from the townships and the villages and the cities. That's based upon what is your property values out of the county's entire property values. So you can see this is provided by Julie Atkins. The 2022 allocation, last year's numbers, and then the 2023 allocation, this year's numbers. So as property values went down, there were some townships that their amount actually went down, and others it went up. Not super large increases, but it's all based upon the property valuations. And then the next page shows for 2024 the anticipated revenue. And what those various different sources are. So you can see there that the C&DD funds are estimated to be 60% of the revenues coming in. The environmental service fees, for all the various different licenses and things like that, almost 400,000, not quite. The budget commission, which is what we call what the townships and villages put in. The state subsidy. I'm anticipating that will go down some, because we received an additional amount last year that we did not normally receive. Fees for services are the combination of environmental, vital specific fees, the birth and death record fees, and nursing fees. Then the levy, contracts, and then miscellaneous. In 2024. We will not have as many of the COVID grants. We'll basically only have 1 or 2 left at that point. So when we look at the general fund numbers on the yellow page, and you look at the actual and estimated for 2022 and 2023, and what's anticipated for 2024, that's the largest reason for that decrease there of about $160,000. You can see there how we're proposing it to be split out among all those different sources. So we are requesting that the budget commission approve an allocation of 200,000 for the 190, which is where it's been since prior to 2010, honestly. And then you can see how we anticipate our expenditures to be in 2024 for the general fund. This is general fund only. So this is our one unrestricted fund. So one of the reasons that we try to have a decent balance in here is because for all grants, this is the fund that pays for them until the money gets reimbursed. We don't receive cash up front for any of our grants. We have to spend the money. And so this is where that expenditure comes from, until the proof is provided to ODH and then we get reimbursed. So then the second yellow page is the C&DD fund specifically, because I know that's of interest to many people. So you can see there the anticipated revenues from the fees associated with the landfill is about 7.4 million is what's anticipated. You can see that we're estimating that 2.5 of that will go right back out the door to other entities. Contract services, we contract both for special legal counsel and for a solid waste consultant, and then an air quality sub-consultant. And so those, in this case, is what our contract services are for. And thinking back to that other section that we could not think of at the moment, that's what it is, you know, elsewhere. That's our primary contract service, out of all contracts. And then, you know, the salary expenditures and the other items like that.
Sure. So your board, the health board,
Right, so we go to them this Thursday.
and so if you're asking this board, this would be the first for me, so are you asking them to take action when one ninety?
No, so actually it has to be approved by our board first, and it goes to the budget commission. And the budget commission says yea or nay, yeah.
Okay, fair enough.
So that's further down here.
I think I misunderstood.
Yeah, that's further down here.
Okay.
And then you can see then from the following pages for each one of the special revenue funds that we have. What the beginning balance is anticipated to be, or actually is in the case of 2022. And then receipts that are anticipated for that came in, and then what the fund balance is anticipated to be, or where it ended in 2022. So again, most of these, many of these are grants, not all of them. Some of them are environmental health programs that specifically by statute are restricted. So that makes up the first half of the list. It looks like the second half of the list are very different grants. We spread it out. Yeah, it's spreading, yeah, depending on what the topic is, their area of expertise.
Anything else?
I think the one that, one or two that we pursued this year, that we pursued last year, we get them this year, is actually to help rebuild our medical reserve fund. And that's volunteers that help us during emergencies, help us with drive-through flu clinics, things like that. And so that was one of the areas where we did not have a very strong medical reserve corps during the pandemic. We put more stress on staff. And so we received funds, federal funds, well, not really federal funds, it's through National Association of County and City Health Officials to help rebuild that. So that was one that we had not pursued in the past, that we did pursue.
Any questions from the table in this room? Very good. So before adjournment, I want to thank Ian and any of your team want to speak. Do you have any questions for them?
They were just not.
Okay. So I want to thank NCOESC. They are so gracious. We're here all the time, right? All elected officials. We have, I don't know how many events out here. And they've yet to ask for any money. So this is a great service for our community. And just thank them if you can. So we really appreciate that. Our next meeting will be March 18th, 2024, the third Monday. And we have it at 3:30. We will be getting this out, in advance. I know everyone wants to leave, but what I like to do, please forget, hold on, is I like to open up for public comment. I like to do that. You got 2 minutes. If anyone want to speak, if you do come up, state your name, please limit it to 2 minutes. You're welcome. And then we're going to adjourn. Okay? Meeting is being recorded. Yeah.
I will go.
Please state your name and,
Hello, my name is Susan Platt. I live in Loudon Township, about 4.5 miles from the dump. Thank you for allowing me to speak this afternoon. I represent Rat Patrol, Inc., which is Residents Against Trash Incorporated. We wish to make a statement regarding Sunny Farms landfill. We understand that the landfill can't be closed. In fact, we don't necessarily want the landfill to be closed, but what we want is for them to be in compliance. We need checks and balances in place. For years, they were testing their own water. They received many violations from the Ohio AG and fines. They paid over $1 million in penalties for violations. There was a train fire there 1 year ago. There was an earthquake there 3 months ago. There was a land fire there yesterday. A disaster is about to happen at the cost of Seneca County and Fostoria residents. It appears that all the owners of the facility are from out of state or outside of the US. Will they care if a disaster takes place? What if they leave and stop operations? Commissioners will be left holding the bag. Who has the funds or expertise to clean this mess up once they leave? This will bankrupt our county. We need to be more involved to ensure proper compliance. We need to stop the 98% of dangerous waste coming from out of state. We need to have a better balance between local and outside waste. A 98% rate of out-of-state waste should not be tolerated. To give you a little bit of perspective of the trash, because it's really hard for me to understand how much trash there is. But I did some figures here. To give a perspective on the amount taken by the landfill, the Empire State Building in New York City weighs 365,000 tons. At 7,500 tons per day, it would only take 49 days to accept the amount of trash here in Seneca County. At the proposed expansion rate, it would take 30 days to accept this amount. I have one more paragraph and I'm done. Many think that East Palestine was a terrible accident, without knowing that this can happen daily in Ohio. There is no law in Ohio to monitor these trains and what they carry. In fact, Governor DeWine was incredulous that we have no laws on the Ohio Revised Code that take all of that into account. We should be proud that Senator Reineke leads the Senate Railroad Committee. We should take advantage of his position, schedule meetings with him, and work with him to protect our community. Did the health department schedule a meeting with him yet? Has the DAC? How fortunate we are that out of 88 counties, the person leading the railroad committee is not only from Seneca County, but he is from Fostoria. Senator Reineke is an excellent leader. He has a lot of legislative experience and he has common sense and he is willing to help us. We need to act. Public agencies in this county need to act now. Thank you and have a great day.
Thank you.
Anyone else?
Hello, my name is Joe Stevens. The EPA claims that the Seneca County General Health District has primary oversight of the landfill. Do you as a board feel confident that one part-time person visiting only 1 to 2 times a month is adequate oversight for such a massive landfill? If not, has Chris Lund, the expert consultant, been contacted to provide insights on how to provide adequate oversight over their daily operations? Thank you.
Hello, I'm Brenda Kuhn and I'm a rural resident of Seneca County and I'm also concerned about what we have lurking in our county and it could be such a disaster waiting to happen. There is a lot of concerns about the radioactive materials contained in the residual ash that is being accepted at the Sunny Farms. Why haven't we installed a radiation detector to protect the community? They're not that expensive. So I know we have funds in this account that we're just not utilizing to go because it has to be used for this dump. So why are we not utilizing that funds? The Brookhaven, New York is concerned for our community because they will be closing their landfill due to a cancer cluster that was caused by the materials that we're going to be receiving in our county. Shouldn't we prepare for that, knowing what has already happened to that community? So I'm just posting it out there, you know, this is something that we really should be thinking about and discussing. This is one little thing on the checklist that we should be thinking about. Thank you.
Hello all, I'm Daniel Straub from Seneca County. And
I'm not a politician, so I'm not a very good speaker, but please bear with me. The purpose of my concerns are important to all in our community, and most important should be concerns of our health board. I have a copy of what I'm about to give out so that if anybody has any questions. I'm reading our mission, vision, and values of our health board. And it states our mission is promoting wellness, protecting the environment for the residents of Seneca County. And our vision is leading our communities to better health. Our core values being truthful and transparent to all that we do and say. And our dependability is meeting our commitments. And I also have one from the state Ohio Department of Health, which also says the mission is advancing the health and well-being of all Ohioans. The community conditions and health outcomes and implementing data-driven evidence-based solutions. I guess that's all I got on that. No, there's more, but my thoughts are that it all starts at the lower level. And I am just ashamed that this country doesn't listen to the community that it serves. It should start with local health departments, and they should gather information to take to the state health departments, which should take to the people that are calling the shots in this country. And I heard you give statistics about the people with COVID. Where's the statistics on children? That's what I'm here to fight for. They're still pushing this vaccine on children. Where is it that you can show me that children are even affected by this? But how many children are going to be infected by a vaccine that has not been properly, and nobody's standing up for it? And I expect our health organizations in this country to start standing up for the people and not politicized by the government. And that's exactly what's happening. And as far as Sunny Farms, there's so much money and politics involved in that they don't care about the people that live here. And they don't care about what the future could cost, not just this county, our streams, our lake, everything could be. I heard it said at one of the meetings that anything that's built by man will eventually fail. So when that landfill fails and it pollutes our rivers, streams, and our lake, who's responsible then? We are. People of Seneca County, because that's where it's at. And we'll be responsible for the cleanup, no matter what it costs, and no matter what it costs to our citizens that live here. So thank you.
Take one more comment. So go ahead.
Bob Hodak, I'm a citizen of Fostoria. As I look around the table, I know many of you. First of all, I want to thank Mr. Watson for his time on the health board. There was a lot of common sense that he used on some hard issues, and thanks, Bob. There's also a fair amount of farmers around this table, or some people that know something about farmers and water. Well, I'm going to tell you right now that the ditch that feeds the city of Fostoria's water system, it starts when you walk out this door. It starts where you walk in the Kroger door from the landfill. That's not safe because all landfills leak. It's just a matter of time. All landfills have disasters. It's just a matter of time. That same ditch goes through Fostoria. It's the portage. It goes through Pemberville. It goes up to Oak Harbor. It goes into Lake Erie. And then for some of you over your way, Rick, Wolf Creek goes the other way, goes through Bettsville, goes into Sandusky River, goes through Fremont and into Lake. They say we don't have any jurisdiction over it, that it's all EPA. Well, I trust the EPA just about as much as I trust that half cup of coffee right there being good. And I'll tell you why. Because now, if anybody watched the news, there's bad air from the train wreck. There wasn't any for 2 months. Now it's bad. The EPA collects money from the dump fees from the landfill. The EPA polices the landfill. Is olden days, they used to say that's the fox watching the hen house. The only thing in the middle is boards like the county health department board or your township trustees or anyone who wants to step up and try and do what's right. So I'm here just to bring it to your attention that if you can read any kind of a map and see where a ditch goes, that the water that comes, all the Fostoria is provided, they pump it out of there into the reservoir, then it feeds them and Arcadia. We're in danger over there. Can happen anytime. They've already been fined for dumping leachate in the same ditch years ago. They've got a big plant, they're putting in $20 million to clean up the air. We don't know if it's going to work. They say it's going to work, it's going to help. But at the same time, the EPA turns around and issues them a new air permit ahead of that even working. They could have waited. The county health board voted not to renew their permit. But the EPA overrode them because they don't care. They don't give a damn about what's happening here. They're just padding their pockets. So at some point, as they say, the shit needs to hit the fan and something needs to stop. And I will not guarantee you, as a past, I've born and raised in this county, been active in it most of my life when I lived here. Somebody's got to stand up, say something and do something. And it's going to take a collaborative effort of a lot of people. It can't be just Eric in Fostoria. It can't be just the trustees. It can't be just the health board and some members on there who are trying to, you know, hold someone's feet to the fire. There's a whole bunch of people that aren't doing what they're supposed to be doing. And they're going to tell you they're in compliance, substantial compliance. Look that up. What in the world is substantial compliance? It's the biggest damn gray area in the whole book. That's it.
I'll be short. My mother lives like a quarter of a mile from the landfill. She had her water tested for the first time this last January. They found PCBs in the water. They found PFOAs, which are both permanent chemicals, easily metabolized by the body. They're not gotten rid of by the body, and they build up over time and cause cancer and things. And we know the PCB contaminated soil was put into the landfill. I contacted the EPA person that I know personally out of state. They told me, I hope she's not drinking the water. The EPA also gave a permit to pollute, basically a permit for wetland impacts after Austin was not able to take a water sample in the wetland that they have near the landfill. They got a permit from the EPA to have wetland impacts on where ODNR knows that they're allowing, you know, our wetlands protected to be polluted. And it is very funny that they are always using the argument that interstate commerce, that, you know, Ohio and meat boards and stuff cannot interfere. But if you look at the Palestine thing, the shipments that were supposed to go to a approved place for disposing of those soils, they stopped it after the first shipment. They said no more, and they didn't take it. Amazing how that works.
appreciate the comments. I want to thank, this table is represented by many electeds throughout the county, and it's all our county, it's not just the landfill impact, not just Foxborough, it's part about the whole county. So, this has been, very good for those of us that, maybe found out something new, great. Be assured that, we're in contact with our electeds. The health board's doing a great job. We can all do more as we become more and more educated and this thing kind of plays out, but, it was said earlier, they need to be in compliance, and we have to have a clean county, and I think all of us feel that, and it's frustrating sometimes how we go about it, but let this meeting be a good meeting, bring us all together and for all awareness, support the health department, and then as we leave here, maybe we can all do a little more than we're doing now. So I appreciate the comments. Does anyone around the table want to say anything before we adjourn? Ms. Jan? Yes, Roger.
Yes, they mentioned about it, it's interstate commerce, so we can't do anything about it. So I called Vlad's office and didn't talk to him, I talked to like Ian Mann, I guess. And he said, oh, no, we don't have anything to do with that. That's your local people. And I said, well, our local representatives tell us that it's interstate commerce. He said, no, absolutely not. So I'm gonna have our local representatives contact him.
Good. Anybody else on the table?
Rick, well, good, Jim.
The term means adjourned. Thank you.